This is the second in our digestive system anatomy and physiology discussion. So we're going to start this discussion with the mouth. So the mouth is actually the site of ingestion where we take in food and we chew it and swallow it. So we have a lot of structures here to cover. The first structure we need to talk about are the labia or lips, which perform a function of making an anterior wall to the mouth. These right here are, of course, the labia or the lips. The next major structure we're looking at are the cheeks, which we can't really see from this picture, but they form the lateral walls of the mouth. And then we have the hard palate here, which is formed by maxilla and palatine bones. Maxilla, of course, being the anterior half, palatine being the posterior half, and the soft palate back here, which is mostly muscle and connective tissue. Those palates form a boundary between the nasal cavity, which sits above the palate, and the oral cavity, right down here, which sits in the mouth area, and that sits below the palate. You may recall from our respiratory discussion, this tip ending here of the soft palate is called the uvula. I'll just stick a U there for that uvula. It closes off the opening to the nasal cavity when we swallow or cough, and that prevents food from traveling up into the nasal cavity. We also have a tongue, which serves as an accessory organ. It is anchored to the mouth floor by a frenulum. This is the piece of connective tissue that you can see when you lift up your tongue and look in the mirror. People who are tongue-tied may have that frenulum snipped a bit so their tongue is a little more loose in the mouth. We also have another accessory organ here that, of course, is the teeth. We'll talk more about those in just a minute. And then we have salivary glands, which we actually can't see from this particular picture. So let's transition to another image so we can talk a little more about the teeth. Adults have a maximum of 32 teeth. That is assuming that if all the wisdom teeth come in, they would have 32. Most adults may have those wisdom teeth removed, or maybe they don't ever even develop. Children will have a maximum of around 20 teeth, and so those teeth begin to emerge as few as a few months old, and they start falling out around 5 or 6 years of age. And of course, those baby teeth, or milk teeth as they're sometimes called, are going to be eventually replaced by permanent teeth called adult teeth. So let's talk a little more about teeth. We have teeth for different structures and for different functions. These front teeth here, these incisors, are used for grabbing and pulling and tearing things like protein and other types of food. So they're chisel shaped. We also have sharp-pointed cuspids, which are canines. We sometimes call those eye teeth. They're also good for biting and tearing food. Once we get back here to the molars, I'm going to draw a line right here that gets us with some premolars and some molars. You're noticing that we have a much broader, wider tooth base. Those teeth are better for grinding. So plant matter like grains are going to be ground by those molars back here in the back portion of the tooth area. In terms of tooth structure, we have a crown that sits above the gum line. That's right here. We have a root that sits below the gum line. And then each tooth has 4 main portions. I've just put some information in here for you to look at as we talk through. We have an outer portion of the tooth called an enamel. That is actually the hardest substance in the human body. That covers the outer structure of the crown of the tooth. Now, in people who have gastroesophageal reflux disease, or in people who maybe vomit on a routine basis, the stomach acid is so strong that it can erode away the tooth enamel. So that can cause brittleness, opens up opportunities for things like cavities when we have acid introduced frequently to that tooth enamel. We also have a cementum region. You can see that over here. And that cementum is what covers the root of the tooth. The dentin is underneath the enamel, and it's much softer. And then, of course, the pulp of the tooth is the center, and that contains the root and some blood vessels. So here you can see the pulp. That includes this structure here with the root inside. Okay, and there's blood vessels that nourish that tooth. In this image, I wanted to show you the periodontal ligament. You can see that right there. This kind of acts as a shock absorber when we chew. And when we wiggle a tooth to pull it as a child, we have to loosen that periodontal ligament in order to extract that tooth out of its socket. Let's talk more about those salivary glands. There are three main sets of salivary glands that surround the mouth cavity. They're pairs. You'll notice this parotid gland sitting here is actually around in front of the ear area. It sits close to where that masseter muscle is located. We also have a aptly named submandibular gland down here that sits up underneath the mandible, and under your tongue you've got a pair of sublingual glands. In reality, you've got hundreds of openings to these salivary glands all around your mouth, and they're constantly secreting saliva into your oral cavity. So what do you need all this for? You need it to help moisten food. You need it to help mix the food with salivary amylase so you can break down some starches. And you need it to help begin the process of digestion. This is chemical digestion that we're talking about because we're using salivary amylase. Interesting picture here shows the facial nerve and how it works to stimulate those three sets of or pairs of salivary glands. If you are dehydrated, you may notice that when you start to eat or drink, you may have some pain as those salivary glands try to produce their saliva. So here's what saliva contains. It's mostly water. It's about 98% water. There are electrolytes dissolved in that saliva. When you are dehydrated, you may notice your saliva is thicker and more rubbery. That's because we require water in our mouth, and that helps us to convert mucin into a more fluid-like substance, you might say, when it's dissolved in water. Most importantly for chemical digestion is the last in the list, and that is salivary amylase. You may recall that ASE ending means what? It is an enzyme. And so this is our first ingredient for chemical breakdown. Salivary amylase breaks down starches. So you may remember that prefix there, amyl, means that we're going to break down or chemically digest a starch. All right, so thinking way back to Bio 210, we know that starch is built from building blocks known as glucose. So you're not going to complete the process of breaking down your starches in your mouth. We just begin the process here. So you would have to hold a piece of food in your mouth for 15 or 20 minutes in order to successfully complete the breakdown of starch into glucose. I don't think I'm interested in holding a piece of bread or a potato chip in my mouth for that long. So we at least begin the process of breaking down starch into glucose here in the mouth. You may recall also from Bio 210 that simple cuboidal epithelial tissue is what makes up these salivary glands. You can see a great shot of simple cuboidal making up that salivary gland right there. Another great view of simple cuboidal. There is a ring of cells making up that parotid gland. And these glands, because they secrete fluids into the mouth, can become blocked. They may have cysts. In rare cases, they may have stones or even salivary gland cancers. One important reason for saliva is to help maintain oral hygiene in the mouth. And so meth mouth, which can result from having had drugs in the system, or even just poor hygiene, can result in tooth decay. So we need that saliva to help rinse away bacteria and the toxins that they produce that can lead to plaque and tooth and gum decay, like you can see in this image. Wow. Let's look at something different. Okay, so this is a viral infection called mumps. It can cause swelling in the salivary glands and testes. In fact, it can lead to sterility, especially in males. So we're looking at a rash and swelling in the salivary glands in this image. So to conclude page 84 in your course pack, the functions of your mouth are ingestion, which simply is defined as eating or putting food into your mouth. Mechanical digestion here is really limited to chewing. The fancy word for chewing is mastication. And chemical digestion here is very limited. It is salivary amylase, which is the beginning of starch breakdown. Like I mentioned, we're not going to complete starch breakdown here. We're just simply going to see it begin. We will actually finish this process later on in another organ. All right, so that should take us down here to the very bottom of page 84. We're going to continue on with the esophagus, or pharynx and then esophagus. So if you will flip on over with me to page 85. Okay, so the pharynx has three regions. You may recall the naso, oral, and laryngopharynx make up the three portions. Obviously, food should not be traveling in the nasopharynx, so I'm just going to mark it out. When you are ready to swallow food, you're going to pass it back into the oropharynx. It will then continue down toward the laryngopharynx. And of course, that epiglottis must cover over the opening to the trachea so you don't aspirate or move food into that respiratory passageway. So the only two portions of the pharynx we're going to worry about are oropharynx here and laryngopharynx. When you swallow food, it's a completely conscious process, although you probably don't think about it too much. Swallowing is known as deglutition, and it involves a buccal phase, cheek phase technically is what it's called. That's a voluntary phase that you initiate swallowing with. And then the second portion of the swallowing process is called the pharyngeal esophageal phase, and that process portion is involuntary. So when you're chewing a ball of food, it's called a bolus. It's moistened with saliva. You make the decision consciously to push that bolus of food to the back of your mouth. When you're ready to swallow, you consciously initiate the swallowing process. So, is this the buccal phase, or is this the pharyngeal esophageal phase I've just described? We just talked about the buccal phase. Okay, so you initiating the swallowing process is the buccal phase. Once you've decided to swallow, you push a bolus of food back into the oropharynx. The muscles back there in the pharynx region are involuntary. They, of course, will take over, moving that food down into the esophagus. And at that point, we've now entered the pharyngeal esophageal phase. So if you've ever swallowed a piece of cheese, maybe from a piece of pizza, you may decide at that point, oh, wait, I want this back. I'm not really through chewing it, and I'm afraid I might get choked. You ever realize how hard it is to get a piece of food back into your mouth once you've initiated the buccal phase and that pharyngeal esophageal phase takes over? You really have to fight against those muscles that are moving that food down toward your esophagus to be, swallowed and moved to the next portion of the process. All right, so the pharynx really has one function, and that is to swallow food. All right, so we'll let this play.
Okay, I just want you to look straight ahead at the wall and say candy, candy, candy. Great. I'm going to give you the cup. This is a barium liquid. I just want you to take one sip and swallow. Great. Just take a couple sips in a row like you're thirsty.
Do you see the epiglottis?
Okay, that's good.
You see the liquid traveling down the esophagus there.
All right, I'm going to give you a teaspoon of some pudding. I want you to swallow that when you're ready. Okay. I'm going to give you your nuts. Just chew that up and swallow. Okay. Do you feel like everything's going down, or do you feel it stuck? Where is it stuck? Can you point to it? Right there. Okay. Just want to see if there's anything still there. Can you point again? Okay. I think it's still there a little bit. Okay. Can you turn around and put your back to the table? Other way. Yeah. Let me have that spoon from you. Okay. I want you to just put your chin up a little bit and say E. Okay, I'm going to give you another teaspoon of that pudding. Just look straight ahead when you swallow that. Okay. Can you just go all the way down? Okay, thanks.
All right, so now we're going to move into the esophagus next. The esophagus is nothing more than a food chute or a gullet connecting the pharynx to the stomach. You'll notice the lining here is stratified squamous epithelial tissue, and that is because food is constantly eroding away the layers of this esophagus. So we're looking at a replacement rate of about every 2 weeks we have a new set of cells come into play in the lining here of the esophagus. All right, so just another view there. We've talked about this image before. We know the lumen inside here is where food is going to travel. And this, of course, is lined with stratified squamous that is in the mucosa layer here that surrounds that lumen or opening. All right, so eventually you come to this point here. This is where the esophagus and the stomach meet. Normally we would think of the division point between the esophagus and the stomach being that cardiac sphincter that divides the two organs from each other. Well, if you want to be specific, the actual junction between the esophagus and the stomach is a tissue change. Notice here in the esophagus, you're looking at stratified squamous epithelial tissue. Right here it abruptly changed. And then you've got simple columnar epithelial tissue that now forms these gastric pits. So that is actually the junction between the esophagus and the stomach. Not technically the sphincter, but rather a tissue shift from one type to another. We know the esophagus travels through an opening in the diaphragm. That opening is called the hiatus. If a piece of the stomach is protruding above the diaphragm, we say we now have a hiatal hernia. So everything from pregnancy to having a job where you pick up heavy boxes routinely or eating really large meals, all of this can put stress on the stomach that, well, it's got to go somewhere, right? The food and the pressure has to push that stomach up and above that diaphragm. The problem with this is now we have a piece of the stomach sitting here. This is churning with acid, and say, let's just say right there is a division point between esophagus and stomach. There is not a whole lot that prevents that acid from continuing up the esophagus and can cause, acid reflux, heartburn, and other problems as that acid churns into that lining of the esophagus. Just a view here of the hiatus, the opening between the esophagus and the stomach. There's a hernia here from where the piece of the stomach has been protruded back up above the diaphragm. And here's the problem. The stomach, although it's simple columnar epithelial tissue, has a lining of mucus that protects from its own acid. The esophagus, even though it's stratified squamous, does not have a thick mucosa lining. So there is not that mucus to protect against the acid if it gurgles up into the esophagus. So what looks nasty over here, this is actually ulcerated esophagus that comes from having acid gurgle back up into that stratified squamous lining.